I'm Dr. Trainor. Today, I want to talk about cholesterol, what it is, why it matters, and how managing it can lower your risk of stroke. Many people don't realize that high cholesterol is a major cause of stroke. When there's too much cholesterol in the blood, it can build up as plaque in your arteries. That buildup can narrow or block blood flow to the heart and brain, leading to heart disease and stroke. But fortunately, high cholesterol can be managed through healthy habits and medication. Damage to arteries can be slowed or sometimes even reversed. Let's talk about how cholesterol affects your brain and what you can do to protect yourself. Cholesterol is a type of fat in your blood. Your body needs some cholesterol, but too much can be harmful. There are two main types. LDL is what we often call bad cholesterol. It can build up in your arteries, form plaque, and raise your stroke risk. HDL is known as good cholesterol. It helps remove extra cholesterol from your blood by carrying it to the liver where it's broken down. There are also triglycerides, another type of fat in your blood. High triglyceride levels can raise your risk of stroke and heart disease. The tricky thing is that cholesterol doesn't usually cause symptoms until it's already caused damage to your arteries. The only way to know your numbers is with a blood test called a lipid panel. This test checks your total cholesterol, LDL, HDL, and triglycerides. For people who've already had a stroke, the goal is to get LDL, or bad cholesterol, below 70. Keeping your LDL this low helps reduce future strokes by slowing down plaque buildup and by making existing plaques more stable. If your cholesterol is high, making lifestyle changes is important whether or not you're also taking medication. You can watch our other videos for more stroke prevention tips, but some of the biggest changes include eating a heart-healthy diet, being more physically active, which is the best way to increase your good cholesterol, and reaching a healthy weight. Even losing 5 to 10% of your weight can make a difference. Quitting smoking is also key. Smoking lowers good cholesterol and harms blood vessels, which makes plaque buildup worse. And limiting alcohol can lower triglycerides and support your overall heart and brain health. For many people, especially stroke survivors, lifestyle changes alone aren't enough. In these cases, we usually prescribe high-intensity statins unless there's a really good reason not to. Statins are the most common medication for lowering cholesterol. They work by blocking an enzyme in the liver that helps to make cholesterol. Statins lower LDL levels and reduce inflammation in blood vessels, which makes plaque less likely to rupture, form clots, and cause a stroke. The most commonly used high-intensity statins are atorvastatin and rosuvastatin at higher doses. These are recommended for people who've had a stroke to help bring down LDL levels as much as possible and prevent stroke. Other cholesterol-lowering options are available and include ezetimibe and PCSK9 inhibitors, which are strong injectable medications for people who need further LDL reduction after using statins. Other, less commonly used medications are bempedoic acid, fibrates, or niacin. Your provider will help decide which treatment is best for you based on your cholesterol numbers, how the medication works for you, stroke risk, and overall health. Now, it's understandable to have concerns about medication side effects, and it's good to know what to look out for. But the truth is, most people do well on statins with few side effects. Some people do experience mild muscle aches. The symptoms can usually be managed by adjusting the dose or switching to a different statin. Serious side effects like muscle damage or liver problems are very rare. But for people at risk of stroke, the benefits of taking a statin far outweigh the risks. If you're having side effects, don't stop the medication on your own. Talk to your VA healthcare provider. There are many ways to adjust your treatment and find something that works for you. The best way to manage cholesterol and stroke risk is through regular checkups and good communication with your care team. If you're prescribed medication, take it as directed. Missing doses can raise your risk. And know your cholesterol numbers. That way you can take an active role in your care. If you're already working on cholesterol, keep it up. And if you haven't had your levels checked recently, now's the time to get started. Thanks for watching. If you have questions about your cholesterol or stroke risk, reach out to your VA healthcare provider. Together, you can come up with a plan that works for you, then stick with it. You can also find trustworthy information at stroke.org. Small changes today can keep your heart and brain healthy tomorrow.